Now, clearly what can also happen alongside of those dental injuries where one batters a tooth hard enough that we knock it out or we break it, is we can be faced with concussion itself. Now, there's been a lot of chat about concussion in the news and the media recently related to contact sports, the sport I like, rugby particularly, where now you'll see that the sportsmen and women, when they are playing and they get a knock to the head, they have to go off for a concussion injury assessment. Now, there are lots of symptoms of that. So if we've had a blow to the head or similar, then we're going to be looking for maybe slurred speech, change to the eyes, including change non-movement of the pupils, coordination, balance issues, vomiting, fluid loss from the nose and ears. That is clearly more significant. A loss of consciousness, a persistent headache, not remembering what happened, sometimes seizures, drowsiness, fatigue, reduced activity level, and sometimes irritability in little ones. Now, sometimes that might be difficult to distinguish from normal children, mine perhaps. The other things that we've also got to look out for and remember is that this is a medical emergency. Yeah, if we think we've got a concussion issue, seek medical advice straight away. But again, as ever, just try and get that sensible history. Have we got any of those symptoms? Lots and lots of them are available online as well to have a look at. So you've got a sensible jumping off point when you're speaking to the doctor, and it is important to speak to a medic, to the doctor, to your GP, or to some of the emergency on-call doctors that are available from your local practice or from your local 111. Concussion is serious and it can go on for a little while. So typically if you have a knock to the head and we've got mild concussion, that means you're going to be off any kind of contact sports or similar for a week or 2 weeks. There's a very well demonstrated pathway to return for rugby. I'm not sure about the other sports, but again, it's online on the RFU's website. Concussion, again, can last, and it can go on for weeks and weeks and weeks. So that's why it is super important, particularly in children, to make sure you get that looked at as soon as you possibly can.